The U.S. has declared a public health emergency to bolster the federal response to the outbreak of monkeypox. Already has infected more than 6,600 Americans. The announcement by the Department of Health and Human Services frees up federal funding and resources to fight the virus, which may cause fever, body aches, chills, fatigue, and pimple-like bumps on many parts of the body. Joining us right now is Dr. Tyson Bell, critical care and infectious disease specialist at the University of Virginia in Charlottesville, Virginia. Glad to have you here, Doc. So how in the hell did we get here where now we're dealing with monkeypox?
I know it's one thing on top of the other, and we were already sick of COVID 2+ years in, and now another public health emergency. But essentially, what we're seeing is the monkeypox virus, or the virus that causes monkeypox, has found a way to infect more people than usual. This has been a disease that's been known to people who are working in West Africa, sub-Saharan Africa, but it's made a jump and it started infecting populations in Europe and the United States, and for that reason, it's got the attention of officials, and cases have been going up. And I think it was the right call to declare a public health emergency so that you can gather resources to attack it head on.
Okay, so I saw a message earlier today, and that was someone who was coming here to Las Vegas for NABJ, but chose not to when this report went out. Let me see if I can pull it out. It said, as of August 1st, there are 23 probable and confirmed cases of monkeypox in Clark County, and the Southern Nevada Health District is looking to keep a handle on the situation. But the thing is, this is what it says. It says the good thing is that the monkeypox signal is relatively low, and it is coming from strategic manholes that service segments of the Las Vegas Strip and from at least 1/15 wastewater treatment plants. Okay, so where's it coming from? And because I'm seeing some reports that say you can catch it only with skin-to-skin contact. So how do we truly protect ourselves?
Right. So really good question. So monkeypox can be detected in the sewage just like COVID can, but the primary mode of transmission looks to be skin-to-skin contact and sexual activity. Now, it can spread other means. It can be on bed linens, for instance, and other surfaces. It can be spread by respiratory droplets. But the primary mode is going to be direct skin-to-skin contact and being in prolonged activity with somebody face-to-face for a long period of time. So the main ways to protect yourself, luckily, we haven't had an explosion of monkeypox to the extent that it's infecting many different kinds of populations like we saw with COVID. It can affect anyone. Let's be clear about that. It's an equal opportunity virus, but it has been predominantly seen in the LGBTQ community and specifically men who have sex with men. So, if you're a member of that community, I think it makes a lot of sense to take extra precautions right now to make sure that you're safe.
So what do we do? Do we not hug people? Do we fist bump? And if you're an individual, how do you detect it? What are we looking for?
Right. So I don't know about you, Roland, but I have not been spending a lot of time in other people's faces in general because I don't want to catch COVID, and we are in the surge of that right now. Now, this is not as easy to transmit as COVID. So if there's anything that can be said that's good, it's that it's much harder to transmit than COVID itself. It's, the aerosols, that's not merely a primary mode of transmission. Now, the symptoms to look out for, there are many, unfortunately, but some of the ones that have been, publicized and seen on TikTok videos and stuff are skin lesions. So, that is one aspect of this virus that presents differently than some of your usual sort of viruses that you can contract. Other than that, fevers, chills, muscle aches, those are very generalized sort of symptoms. But the appearance of the lesions and skin rashes really should be a clue to get checked out.
All right, questions from our panel. I'll start with Dr. Greg Carr.
Thank you, Roland. Doc, thank you, man. Just looking at some of the articles from today, for the U.S. to have 5% of the world's population and a quarter of the reported monkeypox vaccines, seems like you covered all the bases. But you said something quickly that I want to go back to. Maybe that's what stops some people from traveling to Vegas for the NABJ and NASJ, HJ conventions. You said something about clothes, bed sheets. Could this be a problem in hotels? And also, maybe just a quick follow up. We're right at the moment. The dorms at Howard, for example, open up next Monday. Kids are coming back to school. Are you concerned about, and they'll be down there in Charlottesville right around the same time. Are you concerned about students now returning to campuses?
That is a concern of mine. I mean, there are diseases that we expect can pick up when people get in congregate settings. In college, many of us have been to college. We know what happens in college. So I think that is a higher risk setting. So in addition to that, I would add homeless shelters, congregate settings like prisons. These are all areas where it could be a setup for monkeypox to really spread. And so in addition to engaging the LGBTQ community and making sure everyone has the information that they need, we want to make sure that testing, vaccination, and treatment are available in these higher risk communities as well. So absolutely, I want to see plans. I want to see every college have a plan for how they're going to ward this off and potentially deal with a surge, because we don't want to be dealing with it and be thinking about what we're going to do while we're in the midst of it.
Thank you.
Okay.
Yeah, thank you. So my question would be to you, as we continue to battle COVID, do we foresee a vaccine for monkeypox? Is there already a vaccine for monkeypox? And are N95 masks still the strongest mask for people to still wear? I still double mask when I go out in public. Are N95 masks still sufficient to wear?
Great question. So to answer your first question, there is a vaccine that's available. It was a vaccine that was developed to counteract smallpox, but monkeypox is related to smallpox. And so there's a thought that there's good efficacy between this vaccine and monkeypox. It was studied in a small study back in the 80s in sub-Saharan Africa. It wasn't a particularly high quality study. So we need to do more studies to make sure that the vaccine is as effective as it was reported to be in the 80s, the mid 80s or so. But this is what's available. In addition, TPOXX is available as a treatment for people who have been exposed or have early course of disease. So there are some treatments that are available. As far as your question about respiratory droplets, I think an N95 is still a very good way to protect yourself and to make sure that, in that off chance that there could be transmission through respiratory droplets, just to backtrack, it's possible, but it is less likely because, this has been transmitted more so in this country through direct bodily fluid and body-to-body and sexual contact. Respiratory is possible. N95, for multiple reasons, because we're still dealing with the pandemic, is still the highest quality mask that you can wear to protect yourself from both of these.
Brianna.
Thank you so much for being here and answering our questions. I'll admit there's a lot I do not know about monkeypox. So I have a two-part question. One, why is it seen as more prevalent in the LGBT community? And two, what is the difference between, other than the physical look, the difference between chickenpox and monkeypox? What does it do to our body, and can we die from it?
Really good question. So it's very important to just reiterate, this is not a gay male disease, although we are seeing gay and bisexual men bear the brunt of disease in this country so far. I also wouldn't call it a sexually transmitted infection, even though that does seem to be a primary driver of infection in this country. There are other ways that you can contract the virus, and there are other communities that can be at risk. And so that's important because we want to make sure that we're targeting areas that are high risk, but we also don't want to deny anyone access to testing if they have concerns. We want anyone to be able to get testing, but we do want to have a focused effort. And what was your other question? I forgot.
I'm sorry. I was just saying, what is the difference other than physical difference or the appearance difference between chickenpox and monkeypox, and will one die from it? Like, what does it do to your body other than the lesions?
So luckily, in both cases, we have vaccine available for chickenpox, and so we haven't seen large outbreaks of that. These are different viruses that cause different kinds of disease, but again, both have skin manifestations. That's the pox part of chickenpox and monkeypox. They can cause these skin lesions that have these fluid-filled vesicles. So that is a feature that is common to both, but they are different illnesses. And, lucky for us, another thing that we can say that's good is that this version of monkeypox does not seem to be as lethal as some of the earlier versions that we had seen overseas. And so the majority of people who have ended up in the hospital have actually been there for pain control. Because if you have anal lesions, it tends to be very, very painful. And so the oral medications don't tend to work like Tylenol, so people are being admitted for pain control, but not because there's a threat to life or limb or anything like that. So, if there is any bit of good news is that it does not seem to be severe in terms of a risk to life, although it can cause some really intractable pain.
All right, Dr. Bell, we appreciate, man, your advice and counsel. Folks, protect yourself at all costs. Hell, don't hug, don't kiss cheeks, also stuff like that. And like I keep telling people, fist pump work, but I guess at this point, damn a fist bump.
Yep. If you can see their full face,
wave.
Don't be in their face.
Just wave, or just do the black greeting.
Personal space.
That'll work.
Yeah.
All right, Dr. Bill, I appreciate it. Thanks a lot.
All right, thank you, Roland.
Look, hey, Greg, that's the one right there. That's right. You see people like, hey, come on, hug. What up?
That's serious. What
up?
Roland,
That's it.
he had me shook with them sheets, man. I'm like, I see why I don't understand the hotel room. I was like, say some more about these sheets, bro. Because what?
Because I gotta be in a hotel next.
No, great. Hey, y'all understand? I'm on a group chat with a bunch of journalists, and they were talking about coming to Vegas. Man, about half of them talking about they bringing their own sheets. I'm like, first of all, y'all got to understand. I got a set of golf clubs. That bag is about 68 pounds. I was in Tampa on Saturday, so I've been gone home. So total 8 days. I got all the clothes. That suitcase, 67 pounds. Then I got my suitcase with all of my television gear. That's 95 pounds. I ain't got no room for sheets. But here's the problem though. Okay, fine. You change your sheets, but the doc we had on the other day, Dr. Gaffney, talked about how it lives on surfaces. So hell, you could change those sheets. It might be on the damn bedstand.
Wow.
Lysol.
Yeah. I would encourage everybody to watch that interview that you did with her. It's about 25 minutes, 26 minutes long. I was watching it.
Hey, she scared the hell out of me.
You and me both. But I would encourage everybody, Black Star Network app, Roland Martin, wherever you watch Roland Martin Unfiltered, go back and watch that. Please watch that infectious disease specialist episode that that interview he had with her. It'll get you right.
Man, whole time I was thinking, man, just keep your ass at home. Okay, all right, y'all. All right, folks, back to our Roland Martin Unfiltered video in just one moment.
When we invest in ourselves, we're investing in what's next for all of us. Growing, creating, making moves that move us all forward. Together, we are Black beyond measure.
Folks, another state has declared a state of emergency due to monkeypox. It is growing across the country and across the world. Nearly 800 cases have been reported in California. Governor Gavin Newsom declared the state of emergency on Monday and will help coordinate a government-wide response. This comes after cities, after New York State as well as San Francisco declared public health crisis. We're joined now by Dr. Alexia Gaffney. She's an infectious disease expert, and we're certainly glad to have her here. So first and foremost, Dr. Gaffney, what the hell is monkeypox?
So monkeypox is an infection primarily of the skin caused by a orthopox virus or monkeypox virus. It is not at all related to chickenpox. I've gotten a lot of questions about that. So we'll just get that out the way. If you've had chickenpox or been vaccinated against it, it doesn't matter. It doesn't help you with monkeypox because chickenpox is not a true pox virus. So monkeypox, smallpox, pox viruses are viruses that can be transmitted by multiple routes of transmission. And what they clinically present with are these very prominent pox marks or, fluid-filled blisters or lesions on the skin. And in the case of monkeypox, you often, but not in the case of this particular outbreak that we're seeing, but in the traditional case of monkeypox, you would often see lesions that began on the face, around the mouth, around the eyes, and then kind of spread through the rest of the body. In the cases that we're seeing with these current outbreaks of monkeypox throughout the United States and throughout Europe and outside of Central and Western Africa, where they traditionally occur, we're seeing spread of lesions that are starting in the stomach, the abdominal region. We're seeing lots of cases where people are having lesions on the genitals and the rectal mucosa, because although this is not a sexually transmitted infection, we are seeing sexually related exposures and possible sexual transmission. But the primary mode of transition is through respiratory droplets, right? So if I'm speaking and you and I are within 3 or 4 feet of one another and I have those little spittles of saliva that you can see, that can carry that virus that can land on your face, it can land in your mouth or in your nose, and that's why we see the traditional spread from the face down. Monkeypox virus can also be spread through skin-to-skin transmission, right? So if I have lesions on my skin, whether I know they're monkeypox or not, if someone else has skin-to-skin contact with those lesions, they can pick up the virus that way. So some of this, quote unquote, sexual transmission may be secondary to skin contact. And then not everybody who's experiencing monkeypox in this current, public health emergency is having skin lesions. We're seeing patients who have lesions in the mouth, in the back of the throat. We're seeing people who have lesions in the eyes. We're seeing people who have lesions in the rectal tissue or the anal tissue when we're talking about sexually transmitted cases. And so there's multiple routes of transmission. And so, this picture here that you're showing is probably someone who's had the infection for some time. Their lesions are starting to crust over. And that's what happens, right? Someone, and I didn't even mention this, let me take a step back. So the rash is not even the first symptom, Roland. People first become ill with what we call a prodrome of flu-like symptoms. And we always say that, right? Flu-like symptoms. And you can have flu-like symptoms even when you don't have the flu. So you can have fever, fatigue, malaise, headaches. You might have swollen glands or lymph nodes in the neck area, the armpits, the groin, usually in proximity to where the virus was picked up. And then people may have muscle aches, joint pains, and then a week or so after that, they may begin to develop these rashes. And initially the rashes are like flesh colored, and they just start to become raised. They're blister-like, but they don't have that thin, transparent, clear fluid-filled appearance like chickenpox or herpes lesions. The lesions are usually thicker, and then as the lesions age, which is over a period of 2 to 4 weeks, the lesions begin to crust over, and eventually the scabs will fall off, and then the skin will heal. Unlike chickenpox or herpes virus outbreaks, the lesions that monkeypox causes can be very scarring and very disfiguring. So someone like this person here may have evidence of those pock marks for months or years to come, as opposed to other herpes viruses, where you get thin blisters. They may heal up and you may never know they were there. So the running joke on social media is that, people will take monkeypox virus more seriously because people don't mind if they're sick or dead, but people don't want to be ugly. And, I think that's just, points to where we are as a society, as a culture, and as a nation. Like, this is a very serious condition. It can have serious consequences beyond just this scarring. And, here we are yet again, cracking jokes, stigmatizing this condition and trying to link it to solely one group of people. And we'll get into that. But in more serious cases, beyond just feeling terrible for a week and having painful rashes that can persist for 2 to 4 weeks, people can also have encephalitis, so inflammation of the brain. I talked about how lesions can involve the eye, so they can involve the eyelids, but they can also involve like the whites of the eyes, the sclera or the conjunctival tissue. And when that happens, there can be a lot of inflammation and a lot of scarring. People can have visual disturbance and even blindness as a result of that. People can have vasculitis or inflammation of the blood vessels. People can have gut symptoms. So this virus is not just limited to the skin. And so we've seen cases of men who have sex with men who have had rectal involvement and have incredible rectal pain, incredible abdominal pain, lack of appetite, inability to eat, pain.
Doc, hold on. I want you to hold right there. Hold on right there, because I want you to explain why is the World Health Organization recommending that gay and bisexual men limit sexual partners? This one of the stories I pull up here says about 99% of monkeypox cases are among men, and at least 95% of those patients are men who have sex with other men. Why? So, and you have the New York Times has a story here where the headline was, "In monkeypox, gay men confront a crisis with echoes of the past."
Yeah, so it really is just where the virus happened to land, right? So if I went to Europe or if I went to Central Africa or Western Africa and I was patient 0 who happened to bring monkeypox back home with me, or I happened to have, close contact with someone who had that type of travel history or exposure, and I happen to bring that virus back to my community, then we would be saying what? Monkeypox is a disease of Black women physicians or Black women entrepreneurs. So it just happens to be that the virus first landed in someone in that community. And then think about our social networks, right? Roland, you probably hang with people who work in media. I hang with people who work in medicine, and gay men or men who have sex with men, whether they identify as gay or not, are hanging out with and socializing with other gay men and men who have sex with men. So because of the very contagious nature of this virus, and because you can get it through multiple routes of transmission, it is spreading within that community. And so, yes, we do want to protect that community because that's where the virus is predominating right now. But we are kidding ourselves if we believe that this virus is going to solely stay within the gay male population. It can be spread through so many different routes. And we didn't even talk about the fact that you can get it from furniture, bed linens, shared towels, so think about.
Okay, so let's stop right there, because I was on a thread earlier with some folks, and we are headed to Las Vegas for the National Association of Black Journalists Convention. And these folks are like, oh, hell. Some of them talking about they bringing their own bed linen, all kind of other stuff. So, all right, how then? Look, I got to give a speech tomorrow in Tampa. I then fly to Las Vegas. All right. So how does a person protect themselves? Is there is there a disinfectant that we can actually buy to spray on the sheets and the linen? How do we, and then how do you even know somebody potentially has it? If it's so contagious, how do you protect yourself?
So think about like with COVID, right? If you were someone who was serious about preventing COVID and you were going to a media function, a family function, a church function, you would ask, well, what's the rules, right? Do people have to wear masks? Do people have to isolate? Or am I gathering with a group of people who is taking precautions not to go out and get infections? A lot of my patients who know they're at risk, they come in and tell me, Dr. Gaffney, I'm concerned I'm at risk because, I'm going to bars, I'm going to clubs, I'm going to the hangouts and the meetup spots. I don't necessarily have multiple partners, but my partners have multiple partners. Or, people are saying I have multiple partners and I know this is what they're linking this virus to, but it's more than that. So really it's about knowing what the people you are in contact with are up to, and knowing whether or not you are surrounded by a group of high-risk individuals. So I'm still wearing my
Okay,
mask.
Doc. Okay, hold on. All right. So hold on. All right. Okay, so hold on. So it's a perfect example. Okay, so I'm going to a convention.
Mm-hmm.
It's going to be 3,000 people there. Mm-hmm. It's in Las Vegas. Mm-hmm. Okay. I don't know where the hell these people have been. So
you sure
if you can get monkeypox that's on furniture and whatever the hell, what the hell are we supposed to do?
So we're same thing like we've been doing, right? Wash our hands. Hopefully the hotel or convention center that you all are visiting is doing things like disinfecting the surfaces, tabletops, desktops, the chairs that you all will be seated in. Bed linen should be washed in a hotel with hot water and some type of disinfecting process. So hopefully you're staying somewhere where the bed sheets and bed linens have been changed. That's all you can do. That's all you can ask.
Is there anything? So I had someone say they were going to get. Hold on one second. They said they were going to get the Clorox disinfecting mist for the sheets. Waste of money, or does that actually work?
I mean, you can disinfect a non-porous surface with bleach or disinfectants that are labeled as being antiviral or killing viruses on contact. With bed sheets, bed linens, I mean, you would have to saturate them and let them dry. So that's a little challenging. I would go somewhere where they have good ratings and where I think they're, cleaning their bed linens. And I suppose you could Lysol the sheets, but no one can make any promises regarding that. In terms of what you could realistically wipe down and disinfect when you get on the airplane, right? Wipe down the window, wipe down the armrest, right? Wipe down the seatbelt buckles, wipe down the tray tables, and then clean your hands with disinfectant afterwards. I wouldn't be wearing short shorts or short pants on an airplane, a train, or any of those things. I'd be wearing long pants, because you're sitting in a seat for hours, and they're not cleaning planes the same way they did when COVID first landed. And I'm sure they're not changing their cleaning practices just because a particular group of people is now predominantly impacted by monkeypox. We don't see this as an overall public health issue. We do. It is. We know it is. But general society doesn't. The news doesn't. And it's being reported as just affecting this one group of people. And until that changes, we're not going to see the types of universal precautions or universal cleaning where we can expect to just go sit down on any random chair, airplane seat, train seat, surface, and feel safe and protected. So for me, I don't ever get on an airplane in shorts. And this certainly would not be a time where I would start doing that. I would continue to wipe things down with disinfectant and clean my hands as we have been doing over the course of the pandemic. I've never been on a plane without a mask, even pre-pandemic, but certainly since the pandemic. And I have no intention to do so. Nothing on an airplane is so amazing that I need to be breathing in the air of the people around me, because sick people get on and off planes every single day.
All right, so I just posted in this chat, I said, I have a black infectious disease expert on now, and she said that Clorox disinfectant ain't gonna do shit. She said you would have to saturate them and let them dry, and the response was, I'm bringing my own sheets.
So listen, bring your own.
Lord.
But, there's so many things to talk about and so many things that we talk about in the background as a medical community that the general public is not privy to. So when I'm on a call and we're talking about what's happening with monkeypox around the country and around the world, there have been cases where someone who works in a healthcare setting or someone who's taking care of someone with monkeypox, like stripped the bed and gathered up the sheets and got monkeypox infection that way, right? Because we just said this virus can live on the surface of things. So You don't want to be sharing towels and washcloths, and you want to make sure, yes, that you have access to clean bed linens, but you better doggone protect your skin if you're going to go in a hotel with the concern in your mind that I need to bring my own sheets because I don't trust their sheets. Well, if you don't trust their sheets, you don't want to take them up with, short sleeves on and gather them and go throw them in the corner. Now you've had skin to skin contact with a fomite or an inanimate object that can potentially spread this infection. So there's so many things to think about. And I think we just have to be, reasonable. We have to keep our wits about ourselves, and we just have to take basic precautions. Like, I'm shocked that, people didn't really have a habit of just washing their hands and keeping their hands clean pre-pandemic. I'm glad that folks who didn't have learned, but we have to keep that up at this point. I know it's a lot.
Shit, COVID, monkeypox, this shit is depressing. All right, I know I got some questions from my panel.
Ask away.
Let me just go ahead with the questions from my panelists. I got Demario Solomon Simmons, civil rights attorney and founder of Justice for Greenwood. Michael Imhotep, host the African History Network show. Dr. Cleo Monago, social architect, chief advisor of Black Men's Exchange. Glad to have all three of y'all here. I know Demario is real happy. The Omega convention is over because that monkeypox could have spread real quick there. With all the shenanigans that were happening in Charlotte, but we. Oh, you didn't think I was going to take a shot?
There's going to be some skin contact. Y'all don't keep y'all's clothes on.
Let their ass know, Doc. See?
There's some Omegas around.
See?
There's going to be some clothes off and some skin-to-skin contact.
So any Omega meeting can be a breeding ground for monkeypox. All right, Mario, you get the first question then.
I went to HBCU, I know.
Demario, you muted.
Wait, we can't hear you. You're muted.
Oh, sorry. I'm sorry. I was laughing so hard. My God, I can't even say anything. Bros, keep your shirts on. The sister, the doctor just said you can't even wear shorts on a plane. I mean, this stuff, I'm feeling rolling. This stuff is crazy. Monkeypox. Doc, I know you already said it, but can you just once again, what is the best way to protect yourself in addition to keeping all your clothes on, to my brother and my frat brothers?
So know what's going on in the environment that you're traveling to, right? If I'm in New York, we have the highest number of cases, and there are hot spots for the cases based on people's social activities and social behaviors. So if I am going to travel in a state where there's a higher prevalence of the virus, and I know I'm going to hang out with a group of folks who are more likely to have the virus just based on people's social networks and where the virus is spreading right now, then maybe I'm going to fall back, right? But if I'm a journalist, I'm just going to hang out with journalists who've been generally at work. They're not on the party scene. And hopefully they're doing basic things like wearing masks and washing their hands, and that they're reasonable people who would stay their butts at home if they had flu-like symptoms for any reason, then I feel pretty reasonable about that, right? We tend to run in similar circles, whether it is our work groups or our social groups or our parenting groups or whatever the case may be. So you kind of know who's taking things seriously and who's not, and you can just kind of survey and ask questions. Beyond that, you're going to keep wearing a mask because you don't want to pick up COVID or other respiratory viruses or things that are out there. You're going to wash your hands. You're going to avoid touching your face or touching your skin unnecessarily. And you're going to avoid close contact with people whom you don't know and you don't know what they've been up to. Now, when you gather with 3,000 people for working purposes and things like that, Well, maybe you're not going to wear your mask on the stage to give the talk or whatever, but maybe if there's a huge networking event or everybody's in the room, you might keep your mask on when you're shoulder to shoulder with a bunch of folks, or standing in a circle within 6 feet talking to a bunch of folks. Protect yourself in all the other ways that you can from everything else out there, COVID and otherwise. And then, we don't all have access to a monkeypox vaccine. So the most important thing to do is, if you develop symptoms, go seek medical attention immediately.
And Doc, first of all, you must have never been to an NABJ conference. They're going to be partying and all that stuff. That's what Roland does. I thought you knew that.
It's a lot damn safer than Omega convention. I can tell you that.
I don't know. I've been to plenty of NABJ conferences with you, Roland. I don't know how safe it is. Now, Doc, one other question, and I'm done. What are the symptoms?
Trust me, it's safer than y'all conclave.
Hey, shout out to our new grand boss, his brother Ricky Lewis. But Doc, what are the symptoms besides?
Hey man, come on. We ain't got time for all that. Focus on monkeypox.
So before the rash occurs, people will have what we call a prodrome. So early symptoms are very non-specific. It may be fever, but it may not be fever. But people typically will get fatigue or, feel very tired or malaise. They'll have headaches, muscle aches, joint pains. They may have swollen glands or lymph nodes in the neck, armpit, or groin area. And that's typically related to the area of the body where they had exposure or contact with the virus. And then a week or so after that, or a week to 2 weeks, people can begin to develop the rash. And the rash starts off as firm, fluid-filled, I'm going to say blisters, but they're not really blisters because they have a thicker skin or thicker wall than a typical blister would. And they usually pop up in crops or clusters, and lesions can appear at different times. So, and that can occur over a course of 2 to 4 weeks is typically how long people are sick. So if people, are not feeling well, they need to stay their butts at home. And people, if they're not feeling well, they need to, reach back to the people that they've had previous contact with and see if anybody has been diagnosed with anything. Of course, you're going to screen for all the things that you would get screened for, right? Do you have COVID or not? Tests are very readily available. Do you have flu? Do you have some other identifiable condition that can be easily tested for? Because testing for monkeypox requires us as clinicians right now to find a lesion, unroof that lesion, scrub the base of it with a special swab, and send it to a lab for PCR testing to see, is it monkeypox or does it test positive for orthopox virus? And that's how we're confirming cases right now. I gave you way more than you asked for.
All right. All right. Well, Dr. Gaffney, I appreciate it. I've got my next guest waiting. We've got lots more questions, but it won't be the last time we actually have some questions with regarding to this issue of monkeypox. Hopefully these people will take care of themselves, because damn, we already got dealing with COVID, now monkeypox. I don't even want to know what's the third. They say this stuff works in threes. I don't even want to know what's number 3. Dr. Gaffney with polio, Lord. All right.
Yeah,
Doc, we appreciate it. Thanks a lot.
Thanks for having me on. You all have a great day.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
When we invest in ourselves, we're investing in what's next for all of us. Growing, creating, making moves that move us all forward. Together, we are Black beyond measure.
Folks, Black Star Network is here.
I'm real revolutionary right now.
Support this man, Black Media. He makes sure that our stories are told.
Thank you for being the voice of Black America, Roland.
Stay Black. I love y'all.
All momentum we have now, we have to keep this going.
The video looks phenomenal.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
You can't be Black-owned media and be scared.
It's time to be smart.
Bring your eyeballs home.
You dig? The mayor of New York City has declared monkeypox a public health emergency. That took place on Saturday. In a joint statement, Mayor Eric Adams and Dr. Ashwin Vasan, Commissioner of Health, estimated that approximately 150,000 New Yorkers are at risk of exposure to monkeypox. New York State Governor Kathy Hochul issued an executive order declaring monkeypox a state disaster emergency. This order will expand the number of people eligible for monkeypox vaccines, as well as sending vaccine data to New York's health department. These measures come after the World Health Organization declared monkeypox a public health emergency of international concern, with cases rising and vaccine supplies decreasing. You know, it's crazy to me how we're in this situation, Representative Shannon, of people who are so anti-vax. They don't want to take vaccines. And we are seeing diseases that should have never been the case. There was someone who got polio the other day. Hasn't happened in decades. It's because they refuse to get the vaccine.
Absolutely. And leaders, so Georgia is one of the top 5 states right now that is having the most monkeypox outbreaks. It's Florida, Georgia, New York. I think Illinois might be one of the states that's having a ton of outbreaks. But we are hearing from leaders that it's similar to COVID in that we don't know how to control it. We don't really know a lot about it. And so it's really tough on leaders, and it's really tough on those who work in the healthcare space, because we're not even out of one pandemic before, you know, they're trying to figure out how to deal with monkeypox. And so this has been really difficult, particularly in the state of Georgia. And it is difficult getting folks to, you know, really take being vaccinated serious and understanding that you cannot continue to put stress on top of stress on top of stress of the healthcare system without it breaking. We don't have unlimited resources.
I just, it's baffling to me, Julian, that you have so many people who are willing to play with their health this way. I've seen some of the videos folks are posting who caught monkeypox. That shit don't look interesting at all. I am not trying. I mean, when I see it on the legs and thighs and the face, and I'm like, man, y'all can keep that. I'm good.
Well, the irrationality of people who refuse to be vaccinated, who refuse to basically take care of their own health. I mean, this is a public health issue, and many people refuse to deal with it. Our public health, we talked earlier about the infrastructure crumbling, but our public health structure is also crumbling. You look at the number of people who still haven't been vaxxed or boosted. Some of them will brag to you about it. And then we have this new thing, this monkeypox. It does look gross. I mean, it really looks gross. But in any case, if you want to look like that, go for it. Just stay away from me, because apparently even if you brush up against somebody with this stuff, you could catch it. It's highly contagious. So I don't know what's wrong with people, but I lay all this at the feet of the orange orangutan, the previous president, who basically politicized public health. And in doing so, basically turned COVID into an issue. They may have turned monkeypox into an issue, just because these people who follow him about COVID, it's like passing the baton and they're going to just regurgitate the same old nonsense. It's a frightening situation, and people need to grow up and grow up, wake up, and vax up, frankly.
When we invest in ourselves, we're investing in what's next for all of us. Growing, creating, making moves. That move us all forward. Together, we are Black beyond measure.
Have a conversation about these rising cases of monkeypox. Now, if you are not familiar, it's okay. If you're still trying to figure out, well, what exactly is it? How does it affect me? Do I need to get a vaccine for it? All of those questions. And there are still a lot of questions about this viral condition. We can certainly help to try to answer as many of those questions as possible, because the next conversation that we're going to have is with a nurse practitioner. She's been a clinical nurse and has been studying this situation. She's been in the medical field for over 20 years, and she's seen a lot But one thing she has not seen is this conflation of viral health issues that we've been dealing with over these past few months, going from COVID, now dealing with monkeypox. And it was just shared yesterday that there is a polio case that was revealed in New York. Polio. Wow. We want to welcome to the airwaves of the Black Star Network here on The Culture, Nurse Alice Benjamin. Nurse Alice, good afternoon. How are you today?
Good afternoon. I'm doing well. Hope you and the viewers are too.
We are doing well, considering, Nurse Alice, considering. That's all I'm going to say, ma'am. Considering. I don't know where to start in terms of trying to wrap my mind around just some of the medical challenges that we are facing as a people, and of course as a country. And you have been studying this. You have patients. You've been in the medical field for over 20 years. You are a clinical nurse on both the individual and the family side. Is this just totally like foreign to you in a sense of seeing all of these things happen at the same time?
Okay, so I want to preface this by saying that yes, I am a healthcare provider, but I'm also a consumer of health as well. And I'm a mother, I have a family. And so, yes, all of the things collectively that have been happening, if we look at all of our health issues, we look at women's reproductive health issues and the battle that we've been having with that. We look at COVID, and we're barely getting our head above water when it comes to COVID. We, somewhat are resuming normal activity, but, they're saying infection rates are on the rise, and there's a new vaccine, the Novavax vaccine. So we're hearing a lot about that. The polio case in New York. And then now what's right in front of us that we're hearing a lot of these days is monkeypox. So, and, monkeypox, and let me just also say this, I know we're going to talk about this later, but monkeypox is not a gay man's disease. I want to be very clear about that. When we look at our LGBTQ community, a vulnerable population, women's health issues, vulnerable population. We look at COVID, brown and black people, vulnerable populations. I feel like, all minorities, our health are really under attack, and we have to fight to stay healthy. And that starts with being informed and empowered. So I'm excited to get in today's conversation so we can help the people navigate through what seems like treacherous waters right now, just trying to stay well.
Yeah, I think we definitely need to stay well. So you're saying that monkeypox is not a gay man disease. Now, how do you say that? And then yet there is all of this other talk saying that it's being transmitted between two men who have intimate relations with one another. So break that down for us.
Okay, so monkeypox is a viral disease that stems from the monkeypox virus, which is a kind of a cousin, if you will, to smallpox. And I know that the folks who are greatly impacted, disproportionately impacted right now, are gay and bisexual men who have sex with men. That is the majority of people, but that does not mean that other people can't get it. There was actually a study in the New England Journal of Medicine, and they looked at, I believe it was like 600 cases in various countries from April to May. And yes, about 98% of people who were infected were men. And yes, they did get it from intimate and sexual activity. However, the way that monkeypox is transmitted is not exclusively through sex. And there's nothing genetically different about gay and bisexual men that makes them predisposed to this. The way that monkeypox is transmitted is through contact, physical contact, intimate contact through sex. It could be through hugging, massage. It is contact primarily with the lesions, which have a very high viral load. We also believe that respiratory and saliva can carry a high viral loads of the virus, which is why, really kissing someone, being up in someone's face, exchanging those type of fluids, that is how it is transmitted primarily. Now, I'll say this: it happened with gay men. It doesn't. Although their activity, let me back up. We believe that some of this got to the United States from a super spreader event that happened in Europe, and then people traveled, and it found its way to the United States. Now, So while it may primarily right now be occurring in that population of people, they have partners, they have friends, they have families, they have children. And that contact, whether it's intimate and sexual, or it's just I'm hugging my mom, I'm hugging Nana, or whatever the case may be, that is an opportunity for it to spread. And in fact, there are women and children who now have contracted monkeypox. So we know that this is not just a gay person's disease. And we got to be mindful, because we saw this in the HIV/AIDS pandemic. And, people labeled it a gay person's disease, didn't pay it much mind, didn't get the attention it needed until it spread to the general population. If we are not careful, if we do not educate ourselves, if we do not empower ourselves, and if we do not all take the precautions for this, we can find ourselves in a similar situation.
So we can't take this situation for granted. We can't act as if, oh no, I'm immune to this because as a man, I don't have sex with another man, so I'm good.
Absolutely. And I've actually heard patients say that, oh, I'm not worried about monkeypox because I'm not gay, I'm not a lesbian, I'm not, all of these things. And I had to explain to them the actual mode of transmission. And when I explained that to them, I mean, even as simple as this, because, I have friends and family members who are part of the LGBTQ community. If I go and, if one of them were to have monkeypox and I were to give them high five, hug them, give them dap, all those things, there is intimate contact there. And even when we look at, let's take the person who perhaps is bisexual, they contract monkeypox. They can have sex with men, they can have sex with women, then it spreads. Then the woman has it. The woman, unbeknownst to her, she has it. She can spread it to other people, to her children, to it's endless. There are so many opportunities to spread this, and we just need to be mindful of that so we can limit that.
So it's more it's an external condition. Yes. Is that yes. What I'm understanding, Doc? Okay, so it's an external condition, and just close contact, intimate contact can lead to its transmission. As we look at that, it just seems like that's super hard to try to protect yourself from. I mean, you use the AIDS, you talk about HIV, you talked about AIDS, and how, I mean, of course, we had a conversation about this yesterday, but you kind of use the invisible man analogy to say, like, and even with COVID, like we just don't know the full facts of how this thing is going to move, or how it may mutate, or how it may, be spread. I mean, can we make that as something? Can we be honest about that at this point?
Well, yes, let's be honest. So this monkeypox is endemic to Central and Western Africa. And, we did have a small outbreak in 2003, but other than that, we've not dealt with this in the United States. We've just not. So, while the CDC and the public health department say, contact your healthcare provider, we as healthcare providers are real time getting information from the CDC. We are learning about it. We are, studying it. We are trying to keep up with things. So as people come to us for help, we know how to help you. But let's be very clear. I've not been treating this for years and years and years. I'm, unlike a heart attack or a stroke, I got that inside and out. I could say it in my sleep backwards, even if I was, had a little adult beverage. I got it. But with monkeypox, this is new. So I'm just being honest, because people get frustrated. Like, oh, well, this doctor said this and this person said this, and why all the mixed messages? And I will be honest, I have colleagues who have initially also said, oh, this is a gay person's disease. And it is indeed not. And let me just insert this. We talked about intimate contact. This can also be transmitted through objects, bedding, linen. If you are sharing cups and, there's saliva share there. And I think I mentioned to you yesterday, we've all been to a hotel, right? What I recently learned is that while hotels may change the linens, the bed sheets, they do not always wash those comforters between guests. So, we would hope that
wait a minute, Doc. Hold on, nurse. Hold on.
You can listen.
Nurse Alice.
Call your hotel before you go.
Wait a minute, hold on. Time out. You can't drop nothing like that on us, and then be like, all right, so we'll move on to the next point. So in this day and age, in this day and age where you can have a viral condition just from touch, just from contact, just from being in a space. Now you got, I mean, now you learn that hotels may not. So let's start with hotels. Let's not even speak on about motels who have limited resources, right? But some of your major hotels don't always change the comforter.
Yes.
They change the sheets, but they don't always change the comforter.
That is indeed true. So even before monkeypox, we can all agree that that's gross. That, you know, I imagine that they changed the whole bedding, but you know, the linen,
Right.
as well as the comforter. But look, listen, you can go online, you can look this up, you can contact your hotels and ask them. And let me say this, although like I said before, common sense isn't always common. Although we would think that they would do this, hotels are not hospitals. In the hospital mindset, we are very familiar with infectious diseases and the mode of transmissions. The housekeepers, the general managers of hotels aren't necessarily up to speed all the time when it comes to those things, which is why that, you know, we need education and outreach and to talk about things like that. So consumers can say, look, I need y'all to do this and hold them accountable. But when you are going to your favorite hotel, which, you know, it's summertime, people have traveled, you need to call ahead of time and ask them what are their cleaning practices of their rooms. And I want to say this, it's the lesions. When someone has monkeypox, they generally starts off with flu-like symptoms, then they'll develop usually like a dark spot, it'll become raised, then it'll become fluid filled, then it'll be, you know, scab over, dry up, and new skin will emerge. And then, you know, that's the course of what happens with monkeypox. But it's the rashes, it's those raised bumps that are fluid filled that carry the most viral load. And it's when that fluid gets onto the bedding is what makes the bed sheets a concern with, you know, with potentially spreading infection. So that's why we're talking about comforters are so, you know, how many times have you gone into a hotel and not gone into the sheets and just laid on top of the comforter?
Yeah, not anymore.
Not anymore. You're gonna bring your own sheets.
I mean, all right, this will be a great time to get some feedback from our watchers, and folks, post your comments. But many of you are already at this point with the whole situation. All right, King, I see you, brother. Brother King Lee checked in and said, okay, so what the hell am I supposed to freaking do? Walk around in a chemical suit? I am tired of this crap. Nurse Alice. What can we do? At this point, it's like, I've literally talked to people who, you know, dealing with COVID. They're like, you know what? If I get it, I get it. You know what I'm saying? Like people are just kind of over trying to quote unquote protect themselves. They say, look, I'll wear a mask if necessary, but I'm not going to restrict my movements. I'm not going to be, you know, you have masks, you have face masks, you got face shields, now we're talking about, you know, you could be simply somebody rub up against you in a crowded space and you might, you know, transmit something to you. I'm like King Lee, like what are people supposed to do at this point?
So welcome to my world, because in the ER and the ICU, I must gown up, wear masks all the time because I understand the mode of transmission. I understand, right. I get it. You're fatigued, you're tired, you want to get back to normal life, you're tired of the mask, and you feel like you want to I just might be in a bubble. However, I still want to, you know, say, do that if you want to, but then when you end up in my ER and my ICU bed, you're going to sit there and say, man, I wish I would have done this and that. I hear that so much, even with people from other medical conditions, like they've had a heart attack. Oh, I wish I would have, you know, ate healthier, just exercise a little bit more. So people who've come in with COVID, and I've had people who are anti-vaxxers, don't want to wear a mask, like, I don't care, this is made up and blah, 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 blah. They've ended up in my ER, my ICU bed, and they're like on oxygen, can't breathe. And they're like, I wish I would have got the vaccine. Give me everything you got. You want all of the interventions and the help post, but an ounce of prevention could have gone such a long way, because I also want to say there is no treatment or cure for monkeypox. It is viral. It must run its course. And all we can do at this moment is to treat your symptoms. And quite honestly,
So given that, and I'm glad that you brought that point up, if that's the case, if there is something coming from the federal government that says, hey, we have a vaccine that can cure you of monkeypox, that may not be accurate. That may not be true.
So we
As
do have
given
vaccines.
based upon what the medical with medical professionals like you and others know about monkeypox right now, you cannot be cured of it.
Correct. There is no cure for monkeypox. Now, we do have 2 vaccines that have been FDA approved for smallpox, but in this situation, because monkeypox is kin to smallpox, it's being allowed some compassionate use for that. So we have the Janos vaccine, which is a 2-dose vaccine. You get it, and then come back 4 weeks later, and then there's 2 doses to that. And then there's the ACAM 2000, which is a 1-dose vaccine, but that one we're a little leery about giving unless we absolutely need to, because with that one, they're both live viruses, but with that second one, you actually will develop a small lesion and it's going to go through its course. So we don't necessarily want to give that. So there's 2 vaccines to prevent. And if you are someone who's in high risk, let me just say this, if you're someone who's high risk, meaning you are someone who is gay or bisexual, who has sex with men and have engaged, especially in group activity that may put you at risk, or have more than 2 partners, as the CDC is saying, or feel you've been exposed, you want to right away call your primary health care provider or call your local public health department and ask, where can I go to get this vaccine? We have vaccine clinics popping up left and right. We know that this is a major issue, so we're trying to get a handle on it. Now, that's prevention. Now, once you have symptoms of monkeypox, it's usually self-limiting, but I'll say this, many people have said it's painful, it's extremely uncomfortable, especially depending on where the lesions are, because those lesions can also end up in your throat, your mouth, and actually internally. And so, not a pretty sight to see, and especially not something that feels good at all. But in those situations, we do have antivirals, which we can give you IV, and we also have immunoglobulin that we can give you IV, but those have been reserved for very extreme cases.
Let me ask you this, Nurse Alice. How long can the virus survive on the surface?
That we do not know yet. We do not know yet. We do know that it can survive on inanimate objects because people have tested positive and reported having monkeypox, but they've had no international travel. They've not, they don't identify as someone from the LGBTQ community. And so when tracers have talked to them about what their activities are, it's been determined that, it's happened from an inanimate object. And there was one woman in the United States, they're still fleshing out her story, but she's actually reported getting exposed through money, which is very rare. But I just thought, you're gonna Google it, you're gonna read it, so I figured you might as well hear it from my mouth first. And so, but we're still fleshing out her story. You still have to figure out what other activities this person engages in. Who's in their household, other things like that. But she strongly believes that is the only place where she's had her contact, and because of people who've tested positive who've also handled money, apparently. So we're still learning a lot. So let me just say this, we are still learning a lot. You're going to hear lots of unique stories, and until we can catch up, till the scientific community can catch up with data, evidence, all these things, it's going to be something where, I'm not really sure, so let me just take all the precautions I can until I know for certain that I cannot get it from this mode of transmission.
So, and also I think that we need to make this clear. As of right now, based upon the cases, how many people have actually died from monkeypox?
So, where it's endemic,
or is this something that you may not die from? You may not actually, you may catch it, but it doesn't mean that it's a fatal virus condition, right?
Correct. So, in where this is endemic to in Africa, there have been deaths reported that are a very small amount. I was reading one study, out of 25,000 people, there was a reported 9 deaths. So it's not something that we anticipate people dying from. So, people might say, okay, well, then that may give people a false sense of security, like, well, I'm not going to worry about it. However, there are different strains of this monkeypox. Now, I'm not saying that this is going to mutate. However, if you you learn from your past, you apply the lessons learned so you can be better in the future. So taking a page out of COVID's book and taking a page of what has happened in Central and West Africa and other countries, we want to be mindful that although we don't anticipate a mutation of monkeypox, which right now we have the Central African strain, we want to just be careful because we don't know exactly what's going to happen, because that's how viruses survive. They learn how to mutate in their hosts,
right?
Because they want to continue living. So right now death is very, very low, low probability of having. But I'll tell you this, if you do get it, extremely painful, uncomfortable. And we didn't even get into the mental aspects of what this does to people, the discrimination, the stigmatization that happens to someone once they have this, because some people out there are just really mean to people. And especially when we look at the LGBTQ community, they're already a marginalized group. And this adds another layer onto it. And even if you're not someone who identifies that with that group, we believe that the number, which is currently about 6,300 cases in the United States, is underreported, because people don't want to come out forward and say, this is what I have, for being afraid of being labeled and stigmatized for perhaps their lifestyle choices, or for being identified of that community when they are not, so there's lots of layers to this.
So the other part about it also, Nurse Alex, is, and I'm glad that you made that point, that there's the stigmatization, around it. But, I still feel like people are going to just be operating out of fear, right? People are still going to just respond like, oh my God, I got monkeypox. And then it's going to go into a whole different space. How can we have some very realistic and important conversations, honest, truthful conversations about this? That's the part one of my question. And then looking at how the United States government and the CDC dealt with the whole COVID-19 pandemic, should we place our faith that the Biden administration, the CDC, and some of these other medical institutions are going to give us the proper and accurate and one message about monkeypox?
Well, you bring up a good point, because I will say this, the CDC, the federal government, did a horrible job of communicating to the public about COVID, especially when we didn't know as much as they made it seem like we knew. We were learning real time. We were gathering data from all over the world.
Tell the damn truth, man.
Yes. So
just tell the truth. If you don't know, just tell the American people. We don't know what the hell we're trying to do. But this is science. This is medicine. We learn and go. Tell the people the truth.
I absolutely agree. And I think that some of the people who, are at those levels of communication, dispersing that type of information, really are not in tune to dealing with vulnerable and marginalized communities, because oftentimes they didn't look like us. They didn't know our struggles. They're like, oh, social distance 6 feet away. Well, I'm a social distance if we live in a two-bedroom apartment, there's 8 of us. I mean, help me understand. So, we really need people who look like us, who understand our struggle, to communicate these things, which is why I pride myself on talking to people before they become my patients, because I want you to have that bit of information. And even if I'm not your provider, you can go to whoever your provider is and ask them the hard questions, and just be prepared. They may not know because they don't know our struggle. And that's just fact. So, but when it comes to the monkeypox, I believe the government in many of these states, especially those who've declared public health states of emergency, they've learned from COVID, like, oh, no. Let's nip this in the bud. Let's activate this so we can get resources, manpower going, so we can get vaccine and education outreach going, so we can coordinate better, so we can get more vaccines. So that piece that they're doing better in. At least I'm in California, and California, New York, and Illinois are those states that have done that. So that's a step in the right direction. But now communication and dissemination of this to the public, while delicately not trying to stigmatize the LGBTQ community, is going to be their struggle, because they already fumbled it. They fumbled the ball when they were communicating to the general public. Now, when you're trying to communicate this without singling out this community, because they are not responsible for the spread of monkeypox. I want to say that nobody's at fault. This is a communicable disease that's spread by a virus. The monkeypox virus is at fault for the monkeypox virus. That's
Right.
clear. That's fact. So I'm hopeful that they will partner up with community organizations, partner up with the LGBTQ community, and then also, allies of that community to make sure we are disseminating this information in a way that is important and meaningful to everyone. So like I said, I've had people say, oh, this doesn't impact me, I'm not gay. Well, let me read you real quick and tell you how this transmit and how you shouldn't say those type of things. So
Yeah.
it's like a twofer. I'm gonna have to educate you on your etiquette and then also educate you on how this disease is spread. So I can't say for sure that they're going to get it right the first time, but you got people like me that are here to help, and people like yourselves who are allowing us to talk about this on your platforms is really meaningful.
And the other part about that too, Nurse Alice, is the fact that if you've already taken the COVID vaccine, you already got boosted, and then folks start to say, well, you could take this vaccine to deal with monkeypox or this vaccine to deal with the polio situation. I mean, it's a lot going into the body. And there are a lot of people in this country that are against this whole idea of constantly being medicated to deal with these like outside, external threats. How do where is the reconciliation of those two forces? People want to, I think, and I'm the same way. I want to be healthy. I want to keep my family healthy, but I don't want a whole bunch of different chemicals coming into my body. And then, as the industry is trying to learn and go, and then my health becomes compromised as a result of it. And then to add on top of that, you got policies where you can't, if you do fall ill, if you do, you become severely sick, you can't go to Pfizer or can't go to any other pharmaceutical companies and say, hey, your product make me sick, because guess what? They're protected. So, it puts us as the American people in a very, very precarious position.
Yes, I understand. And so for people who may not know, for most vaccines that are FDA approved, if we encounter an injury or a reaction, we can generally, notify the manufacturer, and then that begin a process of some type of compensation or trying to make this right. With the vaccines, the COVID vaccines, especially since they were emergency use authorized. However, FDA, actually Pfizer is now FDA approved. So that there may be some changes in that. I'm unsure about that piece, because you actually may be able to come back to Pfizer now. But when it comes to the vaccines, I know it seems like a lot of medicine being injected into someone, especially if you're concerned about what is it really doing to my body. So we've encouraged people, I'd rather you be protected than not. So if that means that you space this out, by all means, space this out. Now, when it comes to someone who is vaccinated and boosted from COVID, so perhaps if you have Pfizer or Moderna, because those two vaccines have a small risk of what we call pericarditis or myocarditis, which is inflammation around the heart. We recommend that you space the vaccine. So if you're going to get a Moderna or a Pfizer vaccine, but then you're going to go get your monkeypox vaccine, we ask that you wait at least 4 weeks in between, so you don't increase your risk of developing the inflammation around your heart. Because one vaccine alone, you have a small risk, but two vaccines together that both have those risks, we ask you to space those out. But I get it. A lot of vaccines, and it seems like they're all coming at you at once. You're a little leery because you don't really understand the science. We don't have long-term data yet. Perfectly reasonable, and it's okay to feel that way. This is where you as a consumer can do your due diligence, do research, talk to your healthcare provider, ask questions. And if you still, and this is how I am. I'm a healthcare provider, but I'm here to empower you so you can make the best decision for yourself. I can't make you do something. You can ask me, Nurse Alice, what would you do? I can tell you what I would do, but ultimately at the end of the day, it's your decision. I'm going to respect your decision. But and even if you choose not to get vaccinated, I'm still going to offer you tips and suggestions on how to keep yourself safe. But if you ask me, Nurse Alice, would you get these vaccines and which, by the way, even as a healthcare provider right now, I'm not eligible for a monkeypox vaccine, although I might be at risk for it because there's such a limited amount. But if you ask me, Nurse Alice, when the time comes, if you're eligible and you can have access to this vaccine, would you? And my answer is going to be yes.
When we invest in ourselves, our glow, our vision, our vibe, we all shine. Together, we are Black beyond measure.
It's time to be smart.
Roland Martin's doing this every day.
Oh, no punches!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, this difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am rolling with Roland all the way.
Honored to be on a show that you own. A Black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on that.
Stay Black. I love y'all.
I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared. You dig? Seriously, we've been dealing with COVID-19 for 2 years. Now we got to deal with this damn thing called monkeypox. Are you serious? Look, I know folks have been walking around, no mask, things opening up, but the reality is we are seeing with this new COVID strain how it is, of course, hospitalizations are going up all across the country. We're not seeing, though, the same intensity when it comes to testing, when it comes to protection. Dr. Peter Hotez, he's, of course, Texas Children's Hospital virologist. Of course, you heard him. He's been on the show before. Doc, glad to have you back on the show. My goodness, it's a whole lot that's happening.
Yeah, that's right, Roland. A whole lot that's happening, and a whole lot of it is going unrecorded and unseen, both for COVID-19 and for monkeypox. Let's see if I can break it down. I mean, for COVID-19, so everybody's doing home testing, home antigen testing, which is actually a good thing because people are knowing when they're infected and know when they're at risk of transmitting the virus to their family members or their friends. The problem is those numbers are not getting reported to the state health departments and to the federal government, so they go unrecorded. So when you look at the graphs, what you see is a bump when, in fact, probably the number of new cases is as high as anything we've seen in the past, probably as high as the Omicron wave, more than maybe a million new cases a day. So for every one case that's getting recorded, there's probably 7 to 10 that are going unrecorded. So the official numbers are 135,000 new cases a day in the country. It's probably closer to a million or more. The one thing we do know is the hospitalizations, as you correctly pointed out, are going up around 20% over the last 2 weeks, and we're going back over 400 deaths a day. And okay, it's not the 2,000 deaths that we've seen earlier, but 400 deaths a day still means COVID-19 is the leading cause of death in the United States of America. So we've got to really take this seriously.
And look, you talk about taking it seriously. I was at Essence Festival in New Orleans. A lot of folks came back from that with COVID. Thankfully, I didn't. A couple of my staffers did. I was in L.A. The following weekend for Richard Roundtree's 80th. And I came back, and it was last week I was recording my audio book, and man, all of a sudden my allergies sort of kicked up Wednesday and Thursday, and then I felt it. So I took a COVID test on Thursday, negative. Took a COVID test on Sunday, negative. But what's so crazy is like even normally if we're getting a cold or we're sitting here getting allergies, you begin to freak out like, Jesus, am I getting COVID for the third time? And so it's just one of those things. And look, I keep. Literally, I got like 8 home COVID home tests there because you got to stay, frankly, prepared when on all sudden things happen with your body. You're like, okay, is this allergies? Is it a cold? Is it the flu? Or is it COVID?
Yeah, I mean, here's the single most impactful thing I think you can do, and I appreciate your inviting me to come on because there is an important message here. What we know is that the vaccines are not holding up as well as we'd like in terms of both preventing against infections and preventing even against hospitalizations and emergency visits unless you keep up with your boosts. So that is the most important take-home message. Unfortunately, for reasons I've never understood, the Centers for Disease Control still calls 2 immunizations with the mRNA vaccines full immunizations. And once you're more than a few weeks out of your second immunization, you're still vulnerable. So what that means
is what's the distance? Really? So I've had 3. So what should be the distance between, or months or weeks, whatever, from when I got my 3rd one to get my 4th one? Mine was delayed because when I got COVID the first time, I got the antibodies and I couldn't get my booster until 90 days had passed.
So when did you get your 3rd immunization?
Hell, I don't know. Let me look it up. I don't know, Doc.
Just roughly, was it?
No, I don't know.
Last September?
No. This was much more recent. I got, because I got COVID in December. I got my 3rd booster in April, I think. First of all, luckily I got
So you're getting close because...
Yeah, I'm looking up. I got it right here. Keep going. Keep talking. I'll pull it up.
Once you're more than 4 months out, get your booster. And here's why.
So here it is. I got my 3rd dose May 13th.
Okay, so you can kind of hold off a little bit, but not too much longer.
Like what's a little bit? A month?
So I would say 3-4 months after your last boost. So if you got boosted in May, remember you also got a case of COVID, which almost acts like a single immunization.
Well, I got COVID twice. I got COVID in December, and I got it again in May. Right. I got it in May before I got my 3rd booster.
Oh, you got COVID in May and a booster in May?
Yeah.
Oh, okay. Yeah, you're probably good until August or September.
Cool.
But only the 2 of us. If you look at the American people, it's just about only the 2 of us that are keeping track of this stuff. That's the problem. And so too many Americans are thinking if they got 2 immunizations, that's adequate. And now we had some data come out from the Centers for Disease Control last week that says for instance, even if you got a single boost and you're more than 4 or 5 months out, what that means is your protection against hospitalization went down from 75% to 55%. That's why you got to get that second booster. And here are the numbers. Roughly only about 30% of the U.S. population has gotten their single booster, meaning their 3rd immunization, like you got. And I got my 2nd immunization, but very few Americans have done that. So it's really important to be mindful of the fact that if you've only gotten 2 immunizations, get your booster. And if you've gotten your booster and you're more than 4 months out of that booster, get your 2nd booster. And that is what's going to keep you out of the hospital more than anything else.
And again, I'm just trying to warn our folks, look, man, you can't play with this thing. You don't know how this thing moves, how it shifts. You don't know, again, once you've gotten COVID, what happens, down the road, things along those lines. And so it's staying vigilant as best as we can. We got a panelist. We got some questions. Go ahead.
Yeah. I mean, the problem is everybody knows someone who's been vaccinated and got breakthrough infection.
Yeah.
Right. And so there's these groups that are telling people, hey, see, that means that the vaccine's not working. It's not the case. And what it means is if you've been vaccinated and boosted, you could still get breakthrough COVID with these new Omicron subvariants. But you know what? It means that you're going to be doing Zoom calls from home or calling friends from home rather than being in the hospital. And that's the game changer, is that if you keep up with your boosters, you're far more likely to be less likely to be hospitalized or go to the ICU or worse, or go to the emergency room.
Let's go to Makongo. Your question, Dr. Hotez, first.
Yes, thank you, Dr. Hotez, for your continued expertise and leadership in this area. I've been following you for a very long time, and it's greatly appreciated. My question comes to you as a parent. I have a rising junior, freshman, and 2nd grader, and I want to know what your thoughts are as we're going into the fall. What do you think schools should do to be more proactive? Do you see a potential scenario where we're going to be going virtual again, going into the fall, which is extremely stressful? What are your thoughts as it relates to schools and this variant of COVID going forward?
I think, the school boards and the teachers and under a lot of pressure to keep the schools open. So I think you're not going to, unless things get really extreme, I don't think you're going to see school in-person closures and going back to virtual. It's not impossible, but I don't see that. I think it's less likely. I think the more impactful thing to do right now, and I know I sound like a broken record, now that we have vaccines approved for the kids, you should focus on that. So, but again, the American people aren't accepting it. So, for instance, only about 30% of parents have vaccinated their 5 to 11-year-olds, only 30%. And that varies a lot geographically. So if you look at the Northeast, there's a little better compliance, maybe 50, 60% of parents are vaccinating. But, down here in the South, and Roland, Roland and I are both now, we're both Houstonians. The acceptance is really low. So in Louisiana, for instance, Mississippi, only 11% of parents have vaccinated their 5 to 11-year-olds, so really low. And then now the vaccines have been approved for the under 5-year-olds, and and kind of the CDC sent out an SOS 2 weeks ago to say, you know what, of the cohort of 18 million kids under the age of 5, only about 300,000 have gotten vaccinated, so single-digit percentages. So we have a lot of work and advocacy to do to convince parents to vaccinate their kids.
Let's see here as I again fight this cough from the allergies. Let's see, Julian.
Doctor, again, thank you so much for your work and for the enlightenment that you're sharing with us. Here's my situation. I've been vaxxed twice and boosted, but only boosted once. Everyone I know who's gotten the second booster has been sick for 1 to 2 days. I've got a cray-cray schedule, and so I'm trying to figure out when can I afford to be sick as a reaction to the booster. Is that real? Why is everyone getting sick after they get their second booster? Some folks for just half a day, but some for as many as 2 days. Can you explain that to me?
And boost on Friday.
Should I get a second booster?
Get that boost on Friday and go to work on Monday. I'm sorry, Doc, go ahead.
Well, you're partly right, Roland. I mean, it varies. I mean, for instance, I got my second booster, and I compared to my worst immunization was my second one, but my boosters were fine. I had very few symptoms at all. When you get your booster, make certain that you're getting the booster size dose. So the Moderna booster dose is 50 micrograms of mRNA, not 100 micrograms. So possibly the pharmacist gave you the full 100 micrograms. That's a possibility. Although you could have gotten it after 50 micrograms. The Pfizer vaccine seems to be a little less reactogenic, and so maybe that's one consideration as well, meaning you may not have as robust a reaction. But the thing is, those numbers I just said look real. So again, once you're more than a few months out of your first booster, the protection against hospitalization goes down from 75% to 55%, which is a big difference. And that's the numbers that came out of the CDC last week. So when did you get your first booster?
In December.
You're ready for that second booster. I would, unless your doctor gives you some other reason why you shouldn't get it, it's something definitely to consider.
And it does vary. I didn't get sick from any of the boosters.
Yeah, everyone has a different experience. The Moderna vaccine has more mRNA in it than the Pfizer does. So the Moderna has 100 micrograms of mRNA in the initial immunizing series, 50 in the booster. Moderna has 30 micrograms, so less. So if you're getting Moderna, it tends to be a little more as the term that's used is reactogenic, meaning more fever and inflammation. But it also holds up a little better as well because there is more mRNA.
Jeff.
Yes, Dr. Hotez, thank you so much. I am part of the Stepchildren Nation of vaccines. I got the one-shot J&J, and we got that in our family. We went over a year, had absolutely no problems, had no issues. I got sick. I felt sick about 30 minutes after I got the shot, and then it went away. Did not have a problem, was able to avoid COVID until, of course, school came back in and one child got it and it went through the household. I was down for about a day, maybe less than that, and then came right back.
But those of us who got that one-shot J&J, we've been wondering, because that conversation isn't in the mainstream as much, what do we do next to protect ourselves, and what's recommended?
So that's a brilliant question, and you're not alone. So many people who got the J&J vaccine are feeling buyer's remorse because they're not getting instructions on what to do. And here's the reason for it. Unfortunately, our Centers for Disease Control is not, historically has not been collecting information about vaccine effectiveness after it was released for emergency use as we'd like. So we've been depending on Israel in the UK for a lot of our vaccine effectiveness data. They don't have the J&J vaccine. They don't have Moderna either, but they have Pfizer, which is another mRNA, so people kind of extrapolate from Pfizer to Moderna, but they don't have the J&J, so we're not getting as timely information about it. The truth is, the J&J vaccine is a very good vaccine, and in some ways it may give you more durable protection than the mRNA vaccines. But now it's very hard to get. So you're in good shape in the sense that you got one dose of J&J, you had breakthrough COVID. I would still get a booster with either Moderna or Pfizer, and likely that's going to give you a much better virus neutralizing antibody and help you weather this BA.5 subvariant so long. Remember, this BA.5 subvariant is the most transmissible thing we've seen to date, and this is what's been happening. Each new variant or subvariant is more transmissible than the one before. So BA.5 is more transmissible than the original Omicron, the BA.1. That was more transmissible than Delta. That was more transmissible than Alpha, and so on and so forth. So this is is so transmissible that even if you're in a restaurant, indoor settings, if people now, especially when most people are not wearing masks anymore, at least in this part of the country, we're having a lot of trouble convincing people that BA.5 is a serious actor.
Yep.
And if you're not vaccinated, we're still seeing a pretty big rate of hospitalization, even loss of life.
All right, Doc. So, okay, real quick, this monkeypox thing, Alex, the controller, want to know, do masks protect from monkeypox? Okay, we're seeing that, oh my goodness, cases increasing. What the hell is monkeypox? Who's getting it? And how do we protect ourselves from getting it?
So monkeypox, first of all, it's a crummy name because it was first discovered in non-human primates in captivities, but monkeys are probably not big actors in this. It circulates in the rodent populations in Central and West Africa, gets transmitted to people, and has been causing more infections in Africa. In part because previously people were getting vaccinated against smallpox, but they haven't been getting it since the 70s. So it's created vulnerability. Now we've had our largest monkeypox outbreak ever in Europe and North America, particularly in social networks linked to the gay and bisexual male community. Not that it's sexually transmitted, it's happening through close skin-to-skin or oral-to-skin contact, and now we're about getting around 15,000 cases globally, and we're upwards of 2,000 cases in the United States, with the largest number of cases around 500 in New York. So it's through close, intimate contact, skin to skin, skin to oral, and the numbers are really going up. And there's good news and bad news here. The good news is we've got an excellent vaccine for it. It's made by a company in Europe called Bavarian Nordic. It's a pretty safe vaccine. The problem is we don't have enough doses yet. So the Biden administration is hoping for around 700,000 doses towards the end of this month into August, and then around 1.6 million doses by the end of the year. We're probably going to need 2 or 3 times more than that. So we're getting into the situation where we just don't have enough vaccine. So if you're a high-risk group, and that is, having close, intimate relations with partners who have monkeypox, it's a good idea to get vaccinated either after you've had that contact, what's called post-exposure prophylaxis, or as a form of pre-exposure prophylaxis. And the key now to fight this off is to really ramp up both the testing and the number of vaccine doses, because I'm worried that it's going to continue spreading in the population, and there's two things we don't want to happen. One, we don't want the transmission of this become so pervasive that kids start getting it, because kids don't handle monkeypox nearly as well as adults. That's point one. Point two, we don't want to get it into local animal populations, because then it becomes a permanent fixture in the United States, just like it is in Nigeria and Democratic Republic of Congo. So we've got to treat it as a crisis, because if we don't allow those numbers of cases to get up 10,000 cases, 100,000 cases, then we really have a problem on our hands. And so the key is education and awareness about your partners and limiting exposure. Second, getting the vaccine. And three, diagnostic testing. And the diagnostic testing is not as straightforward as it is with COVID-19. One, we don't have home testing yet. It requires swabbing a lesion. And since that's often an intimate part of the body, that's not the kind of thing you usually walk into CVS or local pharmacy to get testing. So you usually have to go to community health clinics that specialize in this. And so the access is not as great. So we still have a lot of work to do to get to where we want to be.
All right, Doc, well, please keep up the good work and say hello to all my folks there in Houston and folks who do great work at the Texas Children's Hospital. And also, y'all shared what was it, your vaccine information with people across the globe. How did that turn out?
Yeah, so far, our vaccine now in India, it's called Corbevax. 65 million doses have gone into adolescents. So it's the major vaccine used in India for adolescents. And we developed it here at our Texas Children's Hospital Center for Vaccine Development and Baylor College of Medicine, which I know, Roland, you know pretty well. And what I want you to do is once we get out of this BA5 wave, when you come down to Houston again, I want to give you a tour of the labs and have you meet our scientists. They'd be
Sounds great. Love to do so. And that also shows you the difference between folks who are trying to save lives, because I saw something the other day where Moderna gave a golden parachute of $926 million to their CEO after getting almost $3 billion from the federal government. And so which is just beyond idiotic.
Roland, we got $400,000 from the federal government. And we made a vaccine for the world. So
$400,000 made a vaccine for the world. Just imagine what y'all could have done with $2.5 billion.
I know, and I think we would have, could have potentially had the whole world vaccinated by now. But
there you go.
Who knows?
All right, Doc, keep up the good work. We appreciate it. Thanks a lot.
Okay, you're the best. God bless.
All right, take care.
It's time to be smart.
Roland Martin's doing this every day.
Oh, no punching!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, this difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am rolling with Roland all the way.
Honored to be on a show that you own. A black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on there.
Stay black. I love y'all.
I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared. You dig?